Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. Today's topic I have taken is a thyroid gland. Now what is thyroid gland, how it is formed, what is the anatomy, where it is located and what are the functions of it we will discuss in this topic, in this video. So the thyroid gland is formed when the baby is inside mother's womb. Initially it is formed near the pharynx, that is at the base of the tongue, which later on becomes the foramen cecum. And from that area, from the base of the tongue, the thyroid slowly descends down and it comes into the neck, that is the position of the thyroid in the neck, which is in the front of the windpipe, that is trachea. So now when the thyroid gland is forming and when it is descending down from the base of the tongue till here, if there is any abnormality in this descent, then congenital anomalies happens, like ectopic thyroid tissue. So that thyroid is not in this position, but thyroid may be somewhere between the base of the tongue till this line. It comes in the front of a bone called as a hyoid bone and your laryngeal cartilages, that is in the front of your sound box you can say, and the windpipe. Now we will discuss about the anatomy of the thyroid gland. Thyroid gland, it is a bilobed gland, or it is also called as a butterfly shaped gland because it has two lobes, right and a left lobe, and it is connected to each other by isthmus. Now it is located in front of the trachea, that is called as a windpipe, and it has the important structures beside this gland, which is very important during the surgery. And all of you should know which are the important structures which are related to the thyroid gland. The thyroid gland is supplied by the blood vessels, mainly by the superior and inferior thyroid artery, and similarly names of the veins, that is the deoxygenated blood from the thyroid gland goes back to the heart. Now it is what are the important structures which are located near to the thyroid gland. The important structures like your windpipe, which is called as a trachea, which is just behind backside of this gland. Then the esophagus, that is your tube through which we eat food, that is called as a esophagus. That is also closely related to it. There are important parathyroid glands, 4 parathyroid glands related to the thyroid. These glands are required for the calcium control in our body. Then the important nerves related to the thyroid gland are external branch of the superior laryngeal nerve. This nerve is important for the fine pitch voice. And another important nerve which is related is the recurrent laryngeal nerve. This is the most important nerve which is very closely related. It is very thin, which is closely related to the thyroid, and its importance is during the surgery because any injury or any damage to this nerve can lead to the decrease in voice or the loss of the voice also. So that's why these are all important structures which are located are important. So the next thing is the physiology, that is what is the function of the thyroid gland in our body. The thyroid gland secretes important hormones which are called as thyroid hormones. Now these thyroid hormones are required for the important metabolism in our body. Now how they are formed? Now for what is the raw material required for the formation of these thyroid glands, and who controls the thyroid gland, like whether it produces by itself or it is controlled by our brain. So now the hypothalamus in our brain, it secretes thyrotropin releasing hormone. This hormone in turn stimulates a pituitary gland, anterior pituitary gland, which is also situated inside the brain, and that will in turn secrete thyroid stimulating hormone, which is commonly called as a TSH, which is usually checked in any investigation for thyroid diseases. This TSH will in turn stimulates the thyroid gland in formation of the thyroid hormones. So indirectly thyroid gland is controlled by our brain for producing hormones. So what are the raw material? Raw material here required for it is iodide. So iodide is the iodine which we take through the food. That's why iodized salt is important. Our iodine content in our body food is important. This iodide will be trapped inside the thyroid gland, and then there are certain chemical reactions which will help in formation of the thyroid hormones. There are enzymes involved in the formation of the thyroid hormones. The final product, which is called as a T3, which is triiodothyronine, and T4, that is thyroxine. You might have heard about thyroxine, which are the commonly available tablets after removal of the thyroid gland or people who are having hypothyroidism. So thyroxine is the final product of formation of the thyroid hormones. These hormones are, after formation, they are stored inside the thyroid gland in thyroid follicles with thyroglobulin protein. This thyroglobulin is also important. During the investigation, thyroglobulin is also checked in certain cancers. Then when body requires it, these thyroid hormones are released into the blood circulation through the carrier protein which is called as a thyroxine binding globulin. This protein will take the thyroid hormones to the peripheral tissues in a bound form, but only the free hormones are the active. So the part of the hormone which is not bound to the thyroxine binding globulin are available for the body to utilize. In this T4 and T3, the T4 is available in abundance in the body, means freely available, but it is less potent. This T4 is usually converted into T3 in the peripheral tissues and then it will be utilized. So T3 is the active hormone which is utilized by the body, but its concentration is less. Only whenever body requires it, T4 is converted into T3. Half-life of T3 is just 1 day, while half-life of T4 is 7 days. Now all these hormones are having values in when we do the blood investigations. Like TSH, that is thyroid stimulating hormone, T3 and T4, they have the particular values. TSH value is 0.5 to 4.5. Free T4 is 0.8 to 1.8 nanogram per deciliter. Now most of the labs will have little bit variation in the lab values, so you should refer to the lab values written on the report. Now the question comes when we call it as a hypothyroidism or hyperthyroidism. So now when you call it as a hypothyroidism, when TSH is high and T4 is low, it is called as a hypothyroidism. That means the brain is brain is asking the thyroid gland to produce more hormone, but the gland itself is not manufacturing that much amount of hormone due to certain conditions or the certain diseases. The gland itself is not producing. Then it is called as a hypothyroidism. And when TSH is low and T4 is high, that means brain is not asking the gland to produce more hormones, but gland itself is producing more amount of hormone due to certain diseases. It is called as a hyperthyroidism. So I hope you understood. When the doctor asks you to do T3, T4, TSH, they look into TSH mostly and T4 to consider whether it is hypo or hyperthyroidism, and accordingly the treatment will be started, whether to give thyroxine or to give the suppressing medicines to decrease the amount of hormone produced in the body. So hope you understood this video. We will discuss about other diseases and swellings related to thyroid in the next videos. Thank you very much.